I very much believe so. I like to pay attention to the same risk factors that Western medical doctors pay attention to, but I also pay attention to quite a few more.
Okay.
So the Western medical doctor and myself will really want to ask the person about their blood pressure, their cholesterol, their family history for heart disease, whether they smoke, whether they have diabetes, and work on modifying those factors.
Okay.
But I'm also concerned about their hormonal balance. And just since we finished talking about menopause in women, males go through something known as andropause.
Andropause.
And as
okay.
men age, the level of testosterone in their bodies tends to fall.
Okay.
The estrogen, actually men have estrogen too, estrogen tends to raise as they age. And as that hormone imbalance takes place, men are more prone to high blood pressure. They're more prone to deranged cholesterol. They're more prone to having sticky blood platelets, the material that clots the arteries.
Exactly.
So I pay a lot of attention to hormone balance and try to regulate that. I'm also looking at whether they have any occult infections in the body. I don't know if you've read about how periodontal disease can relate to cardiovascular disease. That's something to check into. There's other types of infections as well that have been linked to causing the plaques that block off the arteries, causing heart attacks. So I look into that and spend a lot of time working on a person's diet, encouraging them to exercise, getting them on a good nutritional supplement program, and as I mentioned, balancing their hormones.
So both men and women then can benefit then actually from taking, say, natural hormones. Is that correct?
Right. They definitely can. Not everyone needs them, but the
Okay.
ones who do can benefit.
Well, it's interesting to find out that there is some side effects then from taking just synthetic hormones when women are in menopause, though. There's quite a bit of side effects there. I don't think the general public really understands that, though.
Well, I think the women do because they experience those side effects, and many of them stop taking them.
Oh, okay.
You know, even if they really could have used them because let's say they have multiple risk factors for heart disease and they're at risk. You know, and the hormones could potentially have really helped limit that risk. But they have so many side effects from the hormones, they'll just stop taking them.
Let's talk a little bit about inflammatory disease, say like arthritis as an example. Let's talk a little bit about, just for a moment, let's talk a little bit about osteoporosis. It seems to be so prevalent in women. You need more calcium. You need to go to the drugstore and get more calcium or whatever, okay? Can you talk a little bit about what should a woman say if she has osteoporosis, or can we prevent osteoporosis? Is there any other therapy we can use for that, say?
Oh, I definitely believe we can prevent osteoporosis.
Okay.
I think a person, if you're looking at preventing it down the line, if you can have a good whole foods diet, very wholesome diet, and take a decent multi-mineral supplement.
Okay.
The Western medical community has focused on calcium almost to the exclusion of other nutrients.
Exactly, I hear that all the time.
And calcium is definitely important for bone health, but so is magnesium, so is boron, so is vitamin K, and a variety of other trace minerals that all contribute to bone health. So a person needs to be on a good bone health designed multi-mineral supplement, and then then a person should be monitored. Actually, I suggest that women in their 30s even ask their doctor to get a bone density scan so that you can establish a baseline bone density. And then when a woman enters the perimenopausal years, she should have another one to see, has she lost bone? And if she has, then that's a piece of information that tells you you've got to be more aggressive with treatment to prevent osteoporosis. And we've talked a little bit about hormones, but hormones are very important for preventing osteoporosis or preventing bone loss. But it's not just the estrogen. Progesterone appears to make some difference with bone rebuilding, whereas estrogen prevents bone loss. Progesterone can help bones to rebuild. There's been information that DHEA and testosterone in women can also help maintain strong, healthy bones. They're anabolic hormones. And they're hormones naturally found in a woman's body, but hormones that decline gradually with age. So if you need them, and if a person has osteoporosis, it may behoove the person to see a doctor that can help raise the levels of those hormones.
It seems like a lot of these patients should be talking to you then as far as getting some good advice, because it seems that a lot of women that go in, as an example, going through menopause, I know I have talked to a lot of women in my own practice, and they say, well, I go in, I get estrogen and that's it, and they just monitor me and they say I need more estrogen or I need less estrogen, and they run a blood test and that's it. It seems to be the end of the whole situation. I mean, nothing else is monitored. They're not managed, it seems like.
Right.
That's what I have been seeing.
Well, I'll tell you, I've even seen women who have come to me who have been placed on hormones by other physicians, and their blood level has never been checked.
Wow.
And people metabolize hormones differently. Our livers we have biochemical individuality. So our livers handle things differently, and occasionally I'll see a situation where a woman has been taking hormones for many years, and I'll test her blood, and she's been walking around with 3, 4, 5 times the upper limit of what you actually need to protect yourself from heart disease, osteoporosis, and Alzheimer's. And that's dangerous.
That is real dangerous.
That's dangerous. So I think it's very important, and everyone should know that they should ask their doctor to monitor their blood levels.
Okay. Let me ask you another question. What are some of the causes that contribute to so many of a patient's health problems? What do you believe is the underlying causes that contribute to a lot of these problems? It seems to me that patient will come in and they'll have a disease or an inflammatory condition, say like arthritis, and maybe something should have been done years back to prevent this. What is the underlying cause that you see in your practice for a lot of these particular problems?
Well, there's several, but I do find problems with people's diet as kind of a basic place to start. Oftentimes people are eating large amounts of refined carbohydrates and sugars. They're getting chemicals in their food. So I do like to look at a person's diet. The second thing is sometimes people have food allergies that they're unaware of. They may have had these even from birth. And if you have if you're eating a food that you're allergic to, your body is mounting an immune reaction to it and making antibodies to the foods, almost as if the food was a bacteria or a foreign invader of some sort. And this puts your immune system in a state of overactivation, and that can lead to a lot of problems down the line. And so you asked me a bit about arthritis. Food allergies tend to play a pretty big role with arthritis.
Okay, allergies, food allergies.
Yeah, so then I'd say that the next most common underlying factor for a variety of illnesses is adrenal gland deficiencies.
Heard of that a lot.
Yeah, the adrenal glands are little hormone organs that help our bodies respond to stress.
Right.
And because we live in such a stressful culture, so many people's adrenal glands have kind of worn out. They've fatigued a bit, and so they can't quite cope with the demands of daily living, and then the person will develop a variety of symptoms.
Interesting. Now, let me ask you another question. What do you believe to be the cause of most of westernized degenerative diseases? What do you believe is the cause of most of them?
Diet and lifestyle.
Diet is that pretty well, diet and lifestyle would cover, say, maybe 80% of it?
I would say. I mean, the standard American diet, sad.
It's pretty bad.
is very sad.
It's bad.
It is very sad. People are eating fast foods. They're eating foods that are highly refined, where the nutrients have been stripped away. And then we even have the problem where our soils have been so over-farmed and they've not been adequately replaced with all the nutrients. The fertilizers don't contain all the nutrients that the plants actually need. So the plants are deficient to begin with. Then they're picked and shipped and stored and sent to your grocer. And then when you get them, you may cook them and store them and freeze them. And
nothing left.
By the time you eat them, they're so nutrient poor.
Right.
And I believe many of us have profound nutritional deficiencies.
Well, we could talk for hours on that, couldn't we?
We could.
On nutrition.
Yeah.
Let's